Welcome, everyone. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, I'd like to thank you for joining us for the first webinar in a specially designed health communications e-learning series funded by the Delta Dental Community Care Foundation Oral Health Education Fund. All attendees have been entered in mute mode. Please enter any questions you have in the chat box located at the bottom right. If you would like to receive Dental CEU, detailed instructions will be given at the end of this presentation. Please be prepared to write down the course code, copy-paste the URL from the chat box, or take a picture of the QR code with your phone. This learning series is a product of the Texas Fluoridation Campaign, a collaborative partnership between the Texas Oral Health Coalition, the Texas Health Institute, and the University of Texas Center for Health Communication in an effort to provide detailed information on how to create successful health messages to improve health outcomes. One of the coalition's grant deliverables is to provide spokesperson training for grassroots engagement. And what better way to start than with today's presentation, The Power of Audience Insights. As this e-learning series progresses, the presentations will become more focused on community water fluoridation and the Texas Fluoridation Campaign. So please stay tuned to learn when those are scheduled. If you want to learn more about the first 5 presentations in this learning series, please visit the education page on the TechSOC website at www.techsoc.org. Our presenter today is none other than Matt Jacob, who many of you may know or have worked with over the years. Matt's efforts in communications have been recognized or honored by a variety of organizations, including the Association of State and Territorial Dental Directors, National Public Health Information Coalition, HealthLiteracyMonth.org, and the New York Times. He graduated with a bachelor's degree in journalism from the University of Arkansas in 1985 and previously managed communications and marketing activities for the Pew Children's Dental Campaign and the Children's Dental Health Project. Matt is known for translating complex scientific content into messaging that is clear, concise, and compelling, and most importantly, comprehensible to policymakers or the lay public. For more than 20 years, Matt has helped nonprofits and advocacy organizations raise the profile of their issues, particularly in the areas of health and education. It is my pleasure to introduce to you Matt Jacob.
Beth, thank you so much for that introduction, and it's a pleasure to be with you all today. We're going to be talking about audience insights and the power that comes from gaining those insights. You know, communication has a sender and it has receivers, and we need to know as much as we possibly can about the receivers. Who's going to be receiving that message? Who's going to be reading it and processing it? The more we can know about that, the better we can advance our goals as public health professionals and advocates. So let's go ahead and dig in here. I want to begin, of course, with a disclosure, just letting you know that I have no financial or familial relationships to any of the agencies, brands, or products that are in this presentation. So I think it's an important question to ask. Are we skipping some crucial steps? When we proceed to communicate, when we move forward with that objective, we have a tendency to focus here. We begin at step 3 or step 4, right? We're developing the content or the concept for the communication product, the design, the text, and so on. But as the National Institutes of Health remind us, clear and simple communication requires that we start somewhere else. We start with step 1, and that is defining the target audience. And step 2, we don't want to jump past that as well. And that means conducting research into our target audience. And that's going to really be the focus of this presentation, step 2. So there are really 7, I think, key insights that you can gain by doing research on an audience. The first thing is pretty obvious, and I think it occurs to most of us that this would be gained right off the bat, and that is, what do they know? What do they believe about a particular topic or issue? Getting that current knowledge and understanding that is really important. The environment in which our audience is living and working and striving, that's important to know as well. You can develop a crisp, concise, well-worded message, and it's going to fall flat if you haven't written it to take into account some of the barriers that may exist in their community that make it harder to stay healthy. Cultural factors are also important. People's lived experience, that shapes their attitudes and behaviors and how receptive they might be to public health messaging. Very important things to know. Additional insights, learning as much as you can about the audience's level of health literacy. What kind of language do they prefer to be addressed in, to be communicated to? That's certainly meaningful. I think the next one is really near and dear to me, and that is messengers. We spend so much time thinking about messages, but we don't always concentrate quite as much on messengers. So who's going to be delivering that message? Because that shapes how that message is perceived. So you want to learn what you can about the people or group of people who are most trusted by that audience when they receive messages. Communication channels, also very important. What forms of media do they tend to consume? Do they tend to read? Which channels are most respected by the audience? That's certainly an important thing to determine. And then last but not least, I think one of the real values in doing audience research is it gives you the opportunity to message test, which is just a fancy way of saying you can share some of those initial messages that you've drafted in fact sheets or Q&As and other documents and get a reaction from members of that audience. What do they think about that? Do they understand what you're saying? Are they processing it the way you hope they would? Do they seem inclined to want to change behaviors or change attitudes based on what you've written? So getting a sense of which messages are working is also very important. Of course, that's step one. We don't want to jump too far ahead, right? That defining of your audience, so very important. Let's talk a little more about that. This is really the audience that many people are communicating to. It's an audience that's out of focus. You don't really know who it is you're communicating to because you haven't taken those steps and you haven't really defined that audience. That's why defining the target audience is really important. Whether you are developing a toolkit, an infographic, web pages, or other kinds of communication collateral, you want to prepare those with a sense of who I'm communicating to, who is going to be receiving that information, who's going to be visiting that web page. I often, when I'm writing, really want to kind of picture the person, man, woman, teenager, whomever, who is a member of that subgroup. And so I can really get a sense of, okay, I'm talking to that person. And I would just want to underscore that when it comes to target audiences, the public is not a target audience. Now, I fully recognize that a lot of materials are created with the idea that anybody in the public could obtain them, they could visit the web page and so on. I get that. But it is really important to think more broadly and just to think about which subgroup do we really, really hope reaches that web page, picks up that fact sheet. So target audiences can be defined through a multitude of factors, including age level, parental status, educational level, income, and so forth. These are just some examples. And I'm going to give you some examples of research that was done specifically on some of these subgroups just to give you a flavor of that. But it's important to know, for example, if you say, well, we're creating a fact sheet and it really is aimed to go to the public, it's aimed to be relevant to everybody, then I would say, what grade level are you writing that fact sheet for? Because if you're writing that at a 10th or 11th grade level, then it really isn't for the public, because there are many members of the public that are not going to be able to read and decipher that fact sheet. So again, keep that in mind. So If you really are being inclusive and saying, oh, we're trying to reach the public, then you really have to give a little special attention to some subgroups of that audience that may have difficulty untangling and deciphering what you're writing. Audience research can take many forms. I want to walk you through 4 primary ways that you can conduct research on an audience. A literature review is one of those. Key informant interviews, probably a number of you who are participants today have engaged in those at some point or another. Focus groups are commonly used as well. And of course, last but not least, surveys. They can be delivered in various ways. They can be electronic surveys or what we would call online surveys. They can be telephone surveys, or they can also be in-person surveys. I didn't mention that here. That's getting more and more rare, but it still happens occasionally, and depending on the audience, it could make sense. The literature review, I think most of you know exactly what we're talking about, right? You're basically doing a scan of published research that is related to your target audience with an eye to understand what researchers have learned about how to communicate effectively to a particular subgroup of the population. And we're going to, as I said, momentarily be taking a deeper look at some examples of that. Of course, key informant interviews, they can also be very helpful. There is a process for that. You know, you really have to kind of approach it in a very deliberative way. So, you know, you start by thinking, well, what are the questions we'd want to ask them? Draft that list of questions. And then, of course, you have to do some discussion internally about who are the key informants we would want to interview. Even within a subgroup, there's going to be some desire for a deeper level of diversity, right? So if your subgroup is African Americans over the age of 50, you're going to want to make sure probably that you are getting both male and female participants and people of different educational levels and backgrounds and so forth. Number 3, you want to choose a format. Now, this is usually not that difficult. Phone interviews tend to be most convenient and are used more often than not. And then, of course, you actually begin the process of reaching out and inviting these key informants and scheduling their interviews. And you decide ahead of time, you know, which staff or volunteers are going to conduct the interviews. You want to agree on a structure, a protocol for every interviewer to use. You want that parallel nature of it so that, you know, one interviewer is not proceeding in a very different way. If there are going to be follow-up questions, those questions should really be just for the sake of clarity, right? So you really want everybody being asked the same questions and that someone is not ad-libbing or throwing extra questions in that aren't really aimed at following up or clarifying. And then, of course, the note-taking, the interviews themselves, and then the thorough notes, that's very, very important so that people can reflect back on that. You have an option of recording the interviews, and that's something you can consider doing, but of course you would need to clear that with the key informants before you did so. I think it's a good idea to consider sending a gift card to the informants you interview and who, you know, actually complete the interviews. I think it's a nice gesture. This is real value that you're drawing from them. You know, they're giving you insights, and to some extent those are monetizable. So, you know, I think it's an appropriate way to say thank you and realize that they gave not just some time, but they gave you some real interesting and provocative thoughts. Then the interviewers should come together and really do kind of a debrief and sort of discuss their top line impressions. And then finally, you know, someone, it doesn't have to be one of the interviewers, it usually makes sense for one of them to do it, is drafting a summary of the key insights, and that gets circulated internally for review and discussion. I want to circle back to number 9 though. This is really important because having that debrief is a nice way for the interviewer who ends up drafting the summary to be aware of the impressions that others had, right? We don't want that interviewer who's going to be writing the summary to perhaps be unintentionally driven by their own bias of how their interviews went, the tone, the nature of dialogue that they had, right? So getting a sense of how those things might have differed among the interviews is going to be helpful. And then, of course, there are focus groups. You know, they're conducted regularly. The COVID-19 era is going to be interesting to see the effect it has on focus groups, but focus groups for years now have been conducted also virtually. So they need not, necessarily make focus groups, not a tool anymore. This is generally what we would call qualitative research. It's not that there aren't some quantitative questions asked, but it's mostly qualitative. For example, in a survey, you may ask somebody, on average, how many glasses of soda, pop, or soft drinks do you consume a week? And they may tell you 12. You're really wanting that number. That's helpful. In a focus group, you may get that number, but you're really looking to dig deeper. What are the factors that shape what you buy as beverages? How much is cost a factor? Do you drink diet soda versus sugary soda? You're gonna look for more of an understanding of motivational factors that shape whether they drink water or sugary beverages, and when they drink them. So that's kind of just one way to distinguish. Focus groups usually last between 1 and 2 hours. There are some exceptions to that. The moderator is really the person who's helping to kind of generate conversation by asking questions, by sharing drafts of materials, and asking people for their constructive feedback. Participants can vary. You can have a very valid focus group with only 6 people. That number is not maybe ideal in most circumstances, but it's not, impossible to get value out of that. But they can be as high as 15. Usually focus groups are somewhere between 8 and 12. A questionnaire is drafted, and that's what guides the moderator. That's drafted in advance. She or he may seem like they know exactly what they're doing and be very adept, but trust me, they have, in advance, looked at a questionnaire, become very familiar with it, and so they're just able to kind of glance down as they go. This is not a tool for audience research that I would advise anyone kind of jump into. It's a big leap. There's a lot to know that shapes whether you come out of this with really actionable information or not. And so keep in mind, there are research firms out there that specialize in recruiting and moderating and doing the kinds of things that are involved here. So, it's worth considering if you have the budget to connect with them. That moderator, I want to circle back for a moment. So it can be very helpful to select a moderator who's a member of the target audience. That is increasingly done. The idea here is that depending on the subgroup, having a moderator with that kind of cultural connection and that competence can help to build trust and help to keep dialogue flowing, make people more willing to share their thoughts in an authentic way. Usually 1 or 2 people might attend the focus group as observers. They might be in the same room, kind of sitting along the side. Generally, you don't want too many observers. It kind of can create what we call a fishbowl effect. So you don't want people to sort of feel they're being stared at by people who are jotting things down on a legal pad. But that's kind of a rule of thumb. Focus groups are often recorded. That way the moderator can go back or their sponsoring organization and play it back just to reconfirm, what they heard or some important comments. And the moderator generally will announce that right at the beginning, make it clear to everybody so they know that. The participants' names they might be used only first name, right? But their full name will not be used, and that is again just to protect their privacy. Someone drafts a report. A lot of times it's the moderator or the moderator's research firm or organization. And then you want that report to do more than just kind of be in a binder or sit on a shelf somewhere. You obviously want that report to circulate, to be read and reviewed by people in the organization, that commissioned it, so that they come away with some understanding. Let's talk about surveys for a moment. So we hear every day about new surveys from the Gallup organization and a host of others out there, the CBS New York Times poll, and so forth and so on. So these can be fielded 3 different ways. Again, in person, increasingly rare, but in some limited circumstances, it might still be done. Obviously, in an era like COVID-19 and concern about disease transmission, online or phone or even all the more convenient. These are being administered online more and more, in part because it's easier to reach target audiences. You know, a lot of people nowadays, especially millennials and Generation Z, if you're trying to reach those audiences, they don't have landlines in many cases. So if you rely simply on landline numbers as your kind of universe, you're going to have a tough time reaching them. So a lot of times it's used to online is a way to reach those people. Surveys are classified as quantitative research, although, just a little caveat, you certainly don't have to ask questions that are only yes, no, true, false, A, B, C, D. You know, certainly surveys can ask some open-ended questions, but, you know, the more open-ended questions, the longer it takes. And that can be a bit of an impediment. You know, usually once a survey on a phone call gets beyond 15, 17 minutes, you have more and more drop-offs, people who just won't stick around to complete it. Okay, some more information about surveys. So usually at the end, they conclude with demographic questions, and that's just a way to ensure that the people they've talked to are in fact members of the target audience, and to get some additional information that helps them understand how diverse an audience they have reached. Information about age, sometimes income, educational level, parenting status, that kind of thing. And as I mentioned earlier, how long the survey is going to certainly have an effect on the completion rate. So you have to be mindful of that. The wording and sequencing of questions is really important, and it's why not just anyone should throw together a survey and rush out. You know, if you really want to do it scientifically, there is a way to word questions, and there's reasons why research firms are very meticulous about this, at least most of them. So, for example, questions are not, do you have any concerns about X? It's, do you have any concerns, you know, if at all, about blank, blank, blank? You know, so the idea is you don't want to coach or lead your audience into believing the answer you want them to give. So it's just, you know, the way you word a question in a survey is very technical and very important. So what about having a limited budget, right? Matt, these ideas sound great. Gosh, we'd love to do some of these things, but this sounds like a lot of time, might be a lot of money. And that's an important consideration. I certainly understand that. So, you know, there are some distinctions here, obviously. Key informant interviews, they will cost you time, but they will cost little money. A literature review, again, that's going to take some time to do and to analyze and see what you've got, but it will take little money. If you have some staff who belong to the target audience, another plan B is to talk with them, have some lengthy conversations with them to get guidance on messages or message vehicles. It's obviously not the same as having a focus group of 8, 9, or 10, but it can still provide some insights. I noticed several months ago that SurveyMonkey actually has created a market research division that will field questions to, you know, the audience of your choosing. And while there is a cost involved, it is considerably lower than what a typical research firm would charge. So that might be something, you know, worth looking into. So, you know, institutional review boards, right? A lot of times you see a study that involved a survey of a patient population, and you'll notice, you know, this survey was approved by the University of blankety blanks, you know, institutional review board. So IRB approval is generally not required for focus groups or surveys that are deemed to have minimal risk of any physical or psychological harm. And how you define that, it can vary somewhat based on your institution. But if for some reason you do decide that, you know, we should just err on the side of let's get IRB approval, you just want to make sure you build that into your timeline. It doesn't take months and months, but, you know, it will take some time, and you want to make sure that doesn't push your research project 2 or 3 weeks later than you were hoping for it to. So at this point, Gail, Beth, if you have any questions that have been asked, I'd be happy to stop and answer some of those. If not, I can proceed.
Okay, thank you, Matt. I don't see any questions for you. I believe you can continue.
Great, thank you. So let's take a look at some examples of insights that have been gained from audience research. Two very different examples. So there were a group of researchers that were looking to get insights about how can we better encourage, through communication materials, more African American women to get low or no cost breast cancer screenings. The target audience, of course, as I stated, is pretty clear. These were focus groups that were conducted within the state of Georgia. And just to give you a quick rundown, this is not a complete, comprehensive summary of every insight they gained, but these were sort of the top line insights if you read the study that was written about it. And some of these will seem quite intuitive and not surprise you, others may, but this just underscores, remember I spoke earlier about the importance of messengers. Well, here was one insight right off the bat. When they heard from someone who was identified as a breast cancer survivor, that person had a lot of credibility. They were the most trusted messenger. So, to me, this would say if you're planning to launch a campaign, you want to at least have one or two or three of those individuals be delivering messages, or have a letter from them, or have a brief interview with them on a fact sheet, or maybe a newsletter, or some other communication device. That certainly has meaning. I think the second one may speak to a lot of us, whether you're dealing with implementing or carrying out school-based dental programs. Many of us have heard parents or other stakeholders say, oh, well, if it's a free program, is that really worth getting? Is that going to be safe, or is it going to be high quality? And so, many of the African American women in this research, they question the quality of mammograms that were free or low cost. So, to me, that's an alert that you need to really address that potential concern head on. Find some way to do that. Maybe underscore that all mammograms will be performed by board certified medical staff. So you're going to have to kind of touch that base in some way. To deal with that potential impediment. The preference of health information in printed forms rather than electronic, that was helpful to have as well, so that they understand the best channels for communicating. And then, they really want to see data not just about breast cancer in general, but about Black women, and that desire to get data that's specific to them. I think certainly resonates with a lot of us. So that's just one example. And the researchers summed up their paper by saying, the study we've conducted, better positioned us to devise strategies and methods to achieve our goals. So, they really felt like this put them on the right track. Another paper was written about how to communicate to Chinese Americans about type 2 diabetes. And what they did in this case, this paper itself was a systematic review. So they basically did what I mentioned earlier. They conducted a literature review. What are researchers saying? What have they found about the best ways to communicate about this issue to Chinese Americans? And this is sort of a quick summary of what they found. One of the things I think that was interesting was a lot of the social events that are built around food that Chinese Americans may, if they have type 2 diabetes, feel somewhat isolated socially, because they kind of, on one hand, want to go to those social events, but understand that some of the, the dietary issues that may arise that might make it harder for them to control their blood sugar, there's kind of that tension there. And so really thinking of how this is kind of broader than just communication, but how to kind of address that kind of tension. That you don't want them to be socially isolated. By the same token, you want to maybe give them some tips or tools for how to kind of navigate some of the dietary issues of eating at events like that. The use of the term balance or achieving balance, employing that, it's a powerful cultural metaphor these researchers found. And so the idea was, working that into fact sheets and Q&As and other materials, that you really build that into your message because it resonates with your audience. And then this was kind of interesting, that a lot of Chinese Americans with diabetes are still, relying disproportionately on Chinese language media. And so just understanding that, that you really need to, if you're going to place ads, if you're going to place commentary articles or other information, that you really want to work through those channels. Now I want to share a campaign that I worked on a couple of years ago. I was privileged to work with the West Virginia Oral Health Coalition on their Rethink Your Drink campaign. I kind of want to just walk you through it, sort of soup to nuts, and give you a sense of how audience research helped us move this thing forward and made us feel very good about the outcomes. So I don't need to dwell too much on this. I mean, the disease prevalence when it comes to sugar-related, chronic disease, quite high. Diabetes, obesity, and incidentally, the coalition that the Oral Health Coalition was part of was larger. It involved the American Heart Association chapter, the leading children's advocacy group in the state, a pediatrician who has a very high profile and working on public health issues. So, this was an opportunity to really be interprofessional and really work across chronic disease in a positive way. So one of the things that I did was interviewed a person who had conducted research that helped a similar campaign in the state of Maryland, and just debriefing with him. And he offered to talk with me about it, getting some sense of their insights. What kind of research did they do, right? It's a little way of cheating, I suppose, but, rather than only relying on our own research, maybe he has a couple of nuggets of information or good food for thought that could help kind of guide our thinking on this. And so I had that conversation with him. We created an initial design for the Rethink Your Drink website and the content, and that was because we did want something real to share, to do the message testing for, right? Message testing being an important insight. So we convened focus groups, and those focus groups consisted of 23 mothers and 4 grandmothers. We were very cognizant of the number of people, predominantly women, who were primary caregivers to children, and so we didn't want it to just be moms. And so this was a deliberate decision. A lot of aunts, a lot of grandmothers in the state. The opioid crisis has really, had a tremendous effect in West Virginia. There are a lot of moms who unfortunately incarcerated and, otherwise not able to play that role. We made the decision, you'll recall I mentioned earlier, moderators. So we chose a moderator who was a native-born female. She very culturally competent, very understanding of the populations at play here. She also reviewed the focus group script, which I developed, but she reviewed it to just lend some clarity to it, and she suggested a few questions maybe to reword slightly to make them more culturally relevant. I'll give you one real quick example of this. So if you ask somebody in Beckley, West Virginia, about soft drinks or soda, they would have one understanding of that. But in Morgantown, West Virginia, you're in what I call pop land. That's the part of the country where they start referring to soda as pop. So, you just simple things like that, you kind of have to be aware of. That requires a question to be asked slightly differently as you're going about it. Those were the 3 communities where we held the focus groups, very distinct in their own ways. And we really got a lot of positive things out of it. Here were some insights, just kind of run down some of the key ones. We did a demonstration that I thought was kind of a nice element, right? Instead of just kind of talking at them and handing them out sheets of paper and having them score or mark down their reactions, we had someone who actually demonstrated how much sugar was in a bottle of Gatorade by just scooping it out. And before she began, she asked, how much sugar do you think is in this Gatorade? Then she actually dished out the sugar and poured it into a bowl. And most of the people there were quite surprised. Some of them were genuinely shocked that they had no idea there was that much sugar. So Well, this was one quick theme, was that sports drinks get a pass in many ways. People get it. Coke, Mountain Dew, yeah, they're high, they're filled with sugar, they're not healthy for you. But Gatorade and other sports drinks, Powerade, tended to get a bit of a pass. This was kind of a little bit of an awakening for people. Price and taste and smell, they affect whether people will drink water or whether they're going to opt for other beverages. And so that's just important to realize. At convenience stores, sometimes they discount Coke and Pepsi to where it doesn't cost much more than bottled water. And so that's just a reality that, we needed to be aware of. Third, and I think this was most important, is they really wanted to feel like they had real options. Instead of just saying, don't serve soda, water's the only healthy thing, just drink that. They really wanted to feel like, you got to give me some options here. And more about that in a moment. The participants told us they liked the simplicity and the focus of the homepage that we designed for the campaign. They also made it clear that we could appeal to social norms, because participants agreed when we said, do you sense that soda drinking within your social networks seems to be falling? Do you think it's falling? Is it growing? Is it staying the same? Most people said, I do think, other moms that I know, they're not serving as much soda. They're not buying as much soda. So we realized we could leverage that as a social norm to make the case. Athletic coaches, a real wild card in this, and that came out in the focus groups. And then, last but not least, they made it very clear, give us more information, but not too much. We don't want to be overloaded. Here are just a sample of comments that we got during that focus group. Just this gives you a real sense of what parents and grandparents are contending with and what they're feeling. I thought these were really insightful. This is a snapshot, a screenshot of the homepage for the website that we created. The idea here was, let's make it fun, let's make it interactive. The moment you go to that site, you see this orange bottle, and while it looks static here, it is not static online. There is just sugar pouring out of it steadily. And so we're really making that point. And you'll notice we don't have like a Coke or Pepsi looking beverage. We deliberately chose one that looks more like a Gatorade or a sports drink kind of beverage. So we really wanted to make that point. And of course, evidence-based. That's important to all of us. We used plain language. We tried to keep things as simple, as basic as we could. I look at this now and I kind of think maybe even concerned might be pushing it a little bit, but we really tried to keep the language accessible. We either didn't use clinical terms or deciphered them. You'll see what I mean, that first line, soda, parentheses, pop, right? So, really wanted to get that out. In some areas of the state, in some areas of a lot of states, people don't really say diabetes. They refer to, oh, my blood sugar. I've got a problem with my blood sugar. And that's their code for diabetes. So we recognize that, embrace that in our language. One of the really neat things that came out of this was a statewide video poster contest. And we did this on an accelerated timeline. I am still surprised that we got over 100 submissions. I was quietly thinking, oh, we'll be lucky to get 40 or 50. And K-12 students, and we really allowed students in high school to design this campaign. We really said, hey, you tell us, what do you think would be cool? What would be interesting? We had 2 learning activities online that teachers could download and implement in their classes. We got a lot of compliments about that. This was our tagline. It wasn't on every single page of the website, but we really used this on a lot of the handouts and materials. Water whenever, milk with meals. And this relates back to what we got from the focus groups, right? Give us some options. Just don't tell me only water, right? And so we did say milk with meals. Now, nowhere on the website do we promote chocolate milk or flavored milks of any kind, but this was a compromise we made, and the Dairy Council signed on and was a sponsor partly for that reason. But, our idea was water whenever, milk with meals. And then remember the social norms. We really wanted to appeal to that. And so, we did. We really kind of wanted to make them feel like they're joining something. People want to feel like they're part of something bigger than themselves. And so this kind of language was a deliberate attempt of like, hey, this is where people are going. Moms and dads are making these kinds of decisions. Come on board, come along with us. So this was kind of the language. Then we circled back to the original focus group participants, and we didn't expect a whole lot of them to respond, but we just said, hey, you know, thank you again for your input. We want to let you know this website is now live. You know, your suggestions were excellent. You know, just let us know if you have any comments or any other suggestions. And this was really great to get, you know, feedback from several people. Here are two of the excerpts from comments that we got by email. So, you know, this is just kind of additional validation, as well as the fact that these individuals have the potential to be some of your best messengers, right? Their moms, their grandparents, they can share this information. Hey, look at this cool site. I noticed that one of them put it on their Facebook page 2 days later. So, you know, this is something that's worth building into your outreach. So I finished a little ahead of time. I don't know if anybody has questions or comments about this. You know, we've covered a whole lot of ground, but I just want to close by saying that audience research, I think, is so pivotal. I mean, if you really want to achieve your goals, you really want to have content that's going to resonate with your target audience, it really pays to take those days, those extra weeks to have an activity, have a strategy to better understand that audience. What's their lived experience? What are the challenges in their lives? What do they read? What do they listen to? You know, I think more than ever, you know, we invest so much money in producing and printing materials and posting web content to really make that investment pay off. Spending just a little more time, and it doesn't have to cost a lot of money to do audience research, can really pay huge dividends down the line. So, you know, I really encourage you to consider this. Beth Stewart can connect you with me by my email. I'm happy if you have some additional questions even after this training. If you think of something else that you wanted to ask, or you've kind of got this little idea and you kind of want to bounce it off me, I'm certainly happy to listen to what you have to say and give you some reaction. But audience, you know, the power of audience insights is that you build it into your communication, you build it into your messaging, and that is where the power is. Beth, are there any questions that I can answer?
Yes, we had a couple of questions. The first one is from Beverly. Is there an advantage or disadvantage to asking the demographics at the beginning versus end of the survey?
You know, I don't have a great answer for that. I'd have to check with a few survey opinion researchers and others to know more. I think the idea is that, you know, if they get to the point of the survey where they know you're just trying to get real basic information about them, age level, income level, you know, level of education, most people might stick on the phone an extra minute or two, realizing that, okay, those won't be challenging questions to answer. I know the answers right off the top of my head. And maybe they tuck them at the end for that reason, rather than starting at the top and then kind of the more intense questions are asked later. But that's a good question. I don't know why that tends to be the case, but I suspect it's for a reason.
Okay, thank you. Rhonda asked, how were the mothers and grandmothers recruited for the focus groups in West Virginia?
Yeah, so we worked through local health departments who they had a variety of contacts, and I'm going to struggle to remember exactly how they reached out to them, but these were people who had participated or volunteered or played some kind of role in a community campaign, or had signed up, volunteered. But we got them through local health departments, and I think engaging local health departments, by the way, I think was another nice dividend to this. You know, in fact, to hold down the cost, we held these focus groups at local health departments. They had conference rooms. It just lowered the overhead. And so, you know, they felt very bought in, and we shared the summary. But I don't have a lot of details on that. If Rhonda would like to follow up with me later, I can certainly dig into that and get more information.
Okay, thank you, Matt. That's really a good idea to have them at the health departments. Let's see, Susan asked, can you give an estimate on a budget to start something? Ballpark estimate, maybe?
Yeah, so, well, as I mentioned, you know, key informant interviews or literature reviews, you know, those are something that, you know, are not going to cost you much money, little if any money. They will take time, though. Now, the only thing I will say, just in all honesty, is if you wanted to do a literature review, you know, if you have a local school of public health in your area or in your state, you know, you might agree to pay a fee. I don't know. It might be a project, though, that an MPH student might be willing to take on and be looking to do anyway. And so they might find that, you know, useful or helpful. It could be part of a project in their final year of the program. So, you know, I think you can think creatively about these things if you don't have someone on staff who can necessarily, you know, really feels all that comfortable or competent doing a full-scale literature review. Let's talk about focus groups and surveys, though. So focus group costs can vary a lot, and they tend to get more expensive closer to expensive cities, right? I mean, if you want to do a focus group in the greater Los Angeles or New York area, it's going to tend to just be more expensive because of the cost of a moderator, a research firm. All of those costs, you know, play in. Usually, if you hold a focus group, say between 6 and 7:30 in the evening, it's sort of understood and expected that you'll have some sandwiches or, you know, chips or you know, water or iced tea available there for people, since you are kind of overlapping the dinner hours. So you know, you roll that into your cost as well. A focus group, depending on where you are, it could run anywhere, you know, from, I would say, $4,000 to $15,000. It's a wide range, I know, but the reason is it depends a lot on, are you having to pay for the facility? Are you, you know, able to do as we did and have a focus group at the local health department, right? And they're giving that space to you gratis. Are you, for example, recruiting through a research firm, right? There's a cost to having them go out and recruit. They've got great lists, and they'll find you the people you're looking for, by and large, but they're gonna charge you for that. So, you know, you get closer to 15, 16, 17,000 when you're going to a firm and they're doing it all, right? They're going to be doing, you know, the actual recruitment. They're going to devise the questionnaire. They're going to have a moderator there and all of that, and pay for a facility. So, but you get down to the lower end, $5,000 or $6,000 if you're able to hire a moderator separately. I really would. I think the one person in the focus group dynamic that is worth paying for, finding someone from the outside, is the moderator. I've moderated several focus groups. It's a lot of work. It is not easy to do. And I do think there's value in finding someone, you know, from the particular population that you're focusing in on. So like in West Virginia, I just did not feel at all. I felt really like a fish out of water. That was not an appropriate place for me to be a moderator. So we did pay a fee to someone, and she did an excellent job. Surveys. So surveys, again, they're going to vary a little bit depending on whether the means is electronic versus being you know, a survey that's delivered or done by phone. I think, you know, one of the things that you might look into to hold down costs is, you know, a lot of universities do have research centers, and they do some public opinion survey research. You know, major universities will often have a component of that, and sometimes they will take outside requests and will do some research. One of the tricky things about this kind of research, though, with a specific subgroup is you're not trying to just reach everybody, right? You're reaching maybe, you know, white women between 30 and 45, or teenagers of color. You know, you're reaching kind of a specific subgroup, and most survey firms, if you come to them with that, it's going to be pretty expensive. So that could cost for a survey that could be, easily $12,000 to $25,000. Now, there are ways to do some surveys. You can consider maybe a kind of convenience sample. If you're going to be someplace where, you'll find the population in question, and do it more informally and get their email address and then email them the electronic survey, So there are some other ways to do it, but I think it really does, benefit you to think as creatively as you can.
Okay, thank you, Matt. Wonderful details, really nuts and bolts, tangible things that people can do to create a campaign. So thank you so much for this information. If you will, let's see, we have one more question I see that just popped up. We did, let me see here. We did 4 focus groups with 2 with physicians and 2 with dentists in Maryland for $25,000, but that included everything, including a great monitor.
Yeah, thanks to John for mentioning that. That gives a real world, status there. So that's 4 focus groups. So, if I'm looking at it here, 2 with physicians, 2 with dentists. So yeah, so dividing that up, you're talking, it looks like about $6,500. So, I think that's very helpful to know too.
And someone commented on they checked out the West Virginia website and love it. This has been a wonderful beginning of this first presentation in our e-learning series. It was great to see, and I really love the information.
Well, thanks, Beth. It was my pleasure. And yeah, anybody who wants to send an email my way, obviously I can talk to them, or I can connect them with people who have done these kinds of forms of research, focus groups, and other things. So I'm happy to point them in the way that they can learn more.
Okay. Well, thank you, and thank you all for joining us. Well, again, if you have any questions or need any assistance at all, please do not hesitate to reach out. Thank you again, and have a pleasant afternoon.